Let us continue with the previous year NEET question series. So this is a respiratory system question. A chronic smoker for 30 years who worked in a cement factory for 25 years developed mesothelioma. Which of the following will be a most likely association? So here we are dealing with an occupational lung disease. Okay. So whenever a particular occupation is related, we have many possibilities. Like one, the particular occupation could be a trigger for asthma. That is called as occupational asthma. For example, they are working in a dusty environment, etc. They'll get wheezing only during the work time, and the other time they will be normal. The other possibility is hypersensitivity pneumonitis. In hypersensitivity pneumonitis, the same thing. The person is exposed to a particular substance during their occupation, and that leads to an allergic reaction. On subsequent exposure, the same allergic reaction is going to cause some symptoms like cough, expectoration, etc. So examples of hypersensitivity pneumonitis will be, for example, if they are working with birds, we call it as bird fanciers lung. Where the excreta of the birds will be a trigger. Suppose if they are a farmer, we call it as a farmer's lung. So here some fungal filaments will be the trigger. We have a famous byssinosis. Byssinosis is also called as Monday morning fever. Byssinosis is exposure to cotton dust. So what happens in cotton dust? Cotton dust gets exposed. It causes a hypersensitivity reaction. So they develop a wheeze or a cough-like thing. Similarly, we have bagasosis. Bagasosis is sugarcane dust. Malt factories. So this is hypersensitivity pneumonitis. The third category is the actual thing which is called as occupational lung disease. Here, the occupational dust gets deposited in the lung and it's going to cause some pathology. So here we have the common silicosis. Silicosis is silica dust gets accumulated. So it occurs in construction workers, quarrying, mining, etc. We have asbestosis. So asbestosis occurs in shipbuilding, again construction workers. Coal workers pneumoconiosis. So how does these manifest? In silicosis, we must remember the term. It causes fibrosis, obviously. This mimics like tuberculosis. It not only mimics tuberculosis, it also leads to tuberculosis. So the silicosis plus tuberculosis is called a silicotuberculosis. So if a scenario is given, Mycobacterium tuberculosis is positive, there is exposure to dust, it's actually silicotuberculosis. So the fibrosis, I told you, since it mimics TB, it is usually upper lobe fibrosis. And it may be bilateral because dust will enter both the lungs. When fibrosis is severe, we call it as PMF, progressive massive fibrosis. Progressive massive fibrosis is not specific for silicosis. It can occur with other diseases also, like coal workers pneumoconiosis. Right, and whenever something is chronic, it can lead to cancer also. Okay. Asbestosis is specific because asbestosis typically affects the pleura. So we have pleural plugs. It is one typical finding. Pleural plugs. Then we have round atelectasis of the lung. When pleural plugs becomes chronic, when more than 10 years of exposure to asbestos, it leads to a typical tumor called as mesothelioma. This is very specific. Mesothelioma is a pleural-based tumor, where the spindle cells of the pleura proliferate. So this mesothelioma is specific for asbestosis. What happens in coal workers pneumoconiosis? Again fibrosis, and when it becomes very severe we call it as PMF, progressive massive fibrosis. So we will read this question once again. A chronic smoker for 30 years. So when we see this smoker straight away, we always go to the get a thinking that it is small cell cancer of lung. Okay, definitely smoking will cause small cell cancer of lung. But see here, they worked in a cement factory for 25 years. Again cement, think of asbestos. Developed mesothelioma. So in the question itself they are given, there is mesothelioma, cement factory for 25 years. So the answer is obviously asbestosis. So silicosis we discussed, construction workers, it is more common and it doesn't cause mesothelioma. It may cause other lung cancers, but it does not cause mesothelioma. Here TB is the very good association. Again, coal workers pneumoconiosis, we have fibrosis and progressive massive fibrosis, not mesothelioma. Bagasosis we discussed, it occurs in sugarcane industry. It most likely occurs like hypersensitivity pneumonitis, cough, expectoration, etc. So this is about occupational lung diseases.